Then it went down to now the actual facilities. How many ICU beds do we have? And it was a wake-up call because now we had to prioritize who gets treated, who doesn't.
Hey everybody, my name is Angie Murenga. You're watching Just Angie. It's the Monday, 3rd day of January, 2022. And it's Mwenenchi Monday, where we discuss all things governance. And it's very, very exciting. I hope you've had a really good start to your year. And of course, this is such an amazing subject. I have two guests in studio. They'll be introducing themselves shortly, but this is about healthcare, which is so important. What better way to start the year than addressing all issues, healthcare, and taking governance of our healthcare. So karibuni sana, lovely ladies.
Sante sana.
Please look into the camera and introduce yourselves. Who wants to start?
Okay. Oh, thank you very much, Pastor Angie, for having us here. So my name is Effie. I'm a healthcare consultant, a trainer, and a coach, and I'm delighted to be part of Just Angie. Thank you.
You're so welcome.
Good morning, Pastor Angie. Thank you so much for this opportunity. We're really honored to be here as the Healthcare of Ecclesia. And as said, my name is Sheila Chepkonga. I am a healthcare consultant. And I am also a project management specialist.
Okay, so this is what the amazing ladies do, and we wanted to have a healthcare conversation. And I loved one of the topics that you wanted to discuss is the healthcare infrastructure and what lessons are we taking from the COVID season and how has it impacted healthcare and infrastructure. COVID has been real for us 2 years.
Yes.
This is going to be the 3rd. But I think when it first started, I panicked like crazy. I didn't even know what was this. But then we had 2 years, 2020, 2021,
yes,
to sort of go through it, understand it, and now we're in 2022. But what are the lessons we've learned? What should people be aware of? And what do you want to weigh into that?
Okay, maybe I can have a go at it. I think for 2020, 2021 has been a learning curve for the entire fraternity in healthcare. It was something that caught us off guard. It was novel. It smacked everybody, and it came at a time when I think the economy were just stabilizing after the election, and things were picking up. Business was picking up. The children had started the CBC curriculum. Everybody was trying to figure out, what are we doing? How are we doing this? Then when the cases started coming in, I think it really started a trickling in effect of, are we ready as a country? Are we ready as the fraternity in healthcare? Do we know what we're going to do? And I must commend the team. They did the best that they could. The response time, everybody felt maybe we took too long to close the borders, but we did it at the time that we needed to do it. And so health-wise, in terms of infrastructure, I believe it was a wake-up call for us as a nation. It was a wake-up call for the health team to look at, do we really have the capacity that we need to have? Do we have the trained personnel to handle infectious diseases? Because this was an infectious disease. Nobody knew how it would morph, how would it spread. We didn't have the statistics. We didn't have the historical data to inform. In healthcare, we use data-driven approaches. Everything is evidence-based, data-driven. So that's how we come up with solutions that have a better impact, and you can do a progressive mapping to know how things would be attended to, So this was new. Everyone around the world was scrambling. And I think for the team that was constituted, we have brilliant brains in Kenya.
Oh, we do.
We have brilliant.
As I watched them, I was like, wow, we do.
Yes. And just from the leadership, from President Uhuru Kenyatta, going into even how Mutahi Kagwe stepped in and just, those daily briefings, telling people what's happening. And then with the CS, Mwangi, the way she was articulating it, it brought calm. It brought things down. But then it went down to now the actual facilities. How many ICU beds do we have? And it was a wake-up call because now we had to prioritize who gets treated, who doesn't. And just looking at some of the data that that's out there, you know. Globally, the global average number of beds is 27 beds to 10,000 people in the population.
Wow. Of ICU beds?
No, just of general beds. Yes.
Wow.
27 to 10,000 per
People.
population. Yes. Kenya, we are at 14 to 10,000.
That's really crazy. And is that in the rural areas or the urban centers or across the board?
Across the board. So we already have a shortfall. But you see, now this brought all these things into light and it made us appreciate the work that we now need to put into place. And there's several things that within the system have started happening. So there's been an answering to the deficit that has been experienced. So there's a lot that's happening in the background. There are a lot of talents that have come up. There are a lot of new scientists who maybe were behind the curtain that are now, you know, coming to the limelight. Yes.
That's awesome.
Yeah, and we're getting a lot of laboratories also coming to the forefront and having their voice heard, because they're the ones who do the testing, you know, and then they help the doctors interpret that. So that has really helped. It has helped.
Yeah.
Effie?
And just to add on to that, and I like what Sheila has mentioned about the change, that shift that has happened within the healthcare space.
Change is so good.
Yeah, what we saw also really grow in that time is telemedicine. You know, everyone now knew what is telemedicine all about, you know, and I'm sure even yourself probably in terms of, do I need to see my doctor? No, I just need to get my phone.
Yeah.
Check
I was
out.
calling him, telling him, this is how I'm feeling. I'm in panic, you know, because we all have symptoms.
Exactly.
I'm calling him saying, this is what is happening, what is going on, in a real panic.
Yes.
But
Exactly.
And he would now tell me what to do, where to go, which hospital to go to.
Precisely.
It's very true.
Yeah, and then we could also see from the rural home. I'll give an example of my mother who would come for her monthly clinics. She didn't come to Nairobi.
She didn't.
She didn't.
She was
And
like,
neither
nope.
did her friends. All who are up country, everyone was just managing themselves on either telephone calls with their doctors, or people went in to research more. What is it all about healthcare?
Yes.
How can I take care of myself? You know, from a dietary perspective, exercise perspective, yes. So that changed. But again, then the digital space has really grown in this season because we are still in that season. So people had to fast track how they were working, move away from the old ways, change of mindset, as you always tell us. People had to move. So that grew exponentially. The other space that we have seen change in terms of also infrastructure in healthcare was the home care services. I think it was booming business, of course, for those in home care. But again, if you had the right approach.
And if you had, I guess you had to be equipped properly as well, so that you don't spread the virus, and that so that you can manage people at home. But I think also, like you said, and I really like what you're saying, Effie, is we learned. I think we had too much. I don't know if it's drama before. I think we simplified. Things became simple. They became simple. They became real, and only what is necessary do we do.
Exactly.
Because we didn't have now to go to the hospital to spend time in waiting rooms. That was dangerous.
Exactly.
So now you talk to your doctor on the phone.
Exactly.
And then you try to also take care of yourself, do research, find out what I need to do for myself. How do I protect myself and my family? And the increase in the home care. That's amazing. That's amazing.
Very, very amazing, Pastor Angie. And then when we look at the digital space, I'll specifically speak to the insurance space. So what happened is those who were on paper had to, of course, fast track and move into digital. Because
those who were doing the system, the healthcare system was on paper.
Exactly. So because when we talk about infrastructure, you'll also look at the hard part of it. How does that change? Apart from the soft part, where also skills needed to change, skill sets individually, but then now looking at delivery of service. So what I think I have seen, one from Sheila rightfully put it, right from the leadership in MOH and coming down, is that there was a deliberate change to how processes were being done, a deliberate change to how you're going to manage and strengthen the healthcare system in the country. So it really took a dynamic 360 view of how can we improve, you know, from self-care, then push it back again to the processes in the offices, and people are really looking and saying, we can no longer work on paper. And I think one of the detrimental factors has been, you know, the processing of claims to hospitals takes so long.
It does, because it was done on paper.
On paper, yes. Majority were still on that space or in between trying to fast track. So we see even companies like Deloitte, you know, publishing papers after that in terms of percentage increase in terms of uptick of digital spaces, because then everyone had to start thinking, if people have to work from home, how does this change? I've got to make it an enabler that my people have, an ability to work at home comfortably and use again the digital space, and at the same time serve the clientele. Because how do you serve the clientele if you can't, manage their waiting times or manage again their healthcare? So we saw the space again grow a lot with the wellness apps.
Yes.
People
so
now, companies were launching their wellness apps, and everyone now can log in and check, oh, okay, so if I am diabetic, or if I suffer hypertension or whatever, or if my child has probably a special need, how do I support them even at home with therapy?
That's amazing.
So the healthcare space, to me, I say yes, of course, we wouldn't have wanted COVID, but it has also in its positive way brought some very good outcomes.
Yeah, it's ushered us into the next, I think,
absolutely.
Without choice, it left no choice.
Yes.
So whatever reason you are in the paper age, there was no more paper. We have moved. And because it was the world has shifted.
Yes.
And I think one of the other things, like when God does things, I I don't think he brought COVID, but you can use any situation to make ourselves better. The most interesting thing is that nobody could travel. Because you're into medical tourism, you do medical travel and tourism. But this one now, it didn't matter. Whether you had 50 billion, trillion, you had to stay put. It's like the whole world came to a standstill. And for once, I feel like we're all equal. We're all relying on the same healthcare system, same doctors, same processes. Let's see what we're gonna do. You cannot run away. You can't pick up and go somewhere else, because nobody was going to have you. Travel was restricted. Everybody was on lockdown.
No one was invited.
I liked it. I like that sometimes it sort of, it shook us.
Yes.
And then now, okay, we've got to sort this one out. It's like now we're forced to look at our situation at home and make it better.
You're so on point, Pastor Angie, because even as you say that, so as you brought that sort of equilibrium, equality, then what happened is now our local hospitals also had to up their game. Of course, now COVID came with isolation. So also for hospitals, it was an opportunity for them to restructure, or rather also refurbish their facilities, like, now begin to do the ensuits. Because if you need to isolate, you have to isolate in private rooms. So it was an opportunity for them now to relook at their infrastructure. So majority of them now began to reconstruct and actually say that if I want to be a top-notch facility, because that is what we get with medical tourism, then I have to relook at my infrastructure, even before I talk about personnel, which is definitely key, because even personnel had to upskill in capacity, but let me stick to infrastructure first. Then people began to reconstruct, began to make private rooms in their hospitals. And those hospitals that were building, some of them, I recall some two-up country had to bring down and start again to get this model right. Wow. So it has affected a lot of thinking around it, and I think even from a home capacity, like when we talk about home care, one of the home facilities that I supported during that time as we were working as medics, one of the things they kept saying is as they went into homes, they realized maybe some homes were not en-suite built, so people also now began rethinking, how can my home be restructured in the event that I have this? Because again, what we have in Kenya, and I'm digressing a bit when we talk about maybe the old age people, is you find that if maybe you have old parents staying with you and you hadn't factored that in, it becomes a challenge. So you have to now begin to rethink it. So again, in this COVID season, as people went into home care, which was more labor manageable and also not very expensive, you had to relook at your home front. How can because then I have to get a hospital bed home, or probably even the ICU parameters and equipment. So how was that working?
I have to protect these old people from the virus.
And also protect yourself. Because as as you want to protect the elderly, you also have to think they're children.
Exactly.
As much as COVID was not affecting children, we never know.
We never know, because we didn't know.
We didn't know. Even now, we still don't know which direction this is going. But it brought such a complexity in how we view even just how you would flow within your own home. How do I access the living room? How do I access the kitchen without having any interference? So because again, contamination, cross-contamination becomes an issue when you're having an infection issue in your home. So then it also made hygiene.
Yeah.
Personal hygiene came top of
I've
mind.
washed my hands so many times.
Until you start
has.
getting...
And I'm so used to it.
Now it's a norm.
It's just a norm.
Yes.
It's a norm to wash my hands always.
Absolutely. So COVID took us back to basics. Primary health care.
Yeah.
You know, wash your
Absolutely.
hands.
Absolutely.
You know, ventilate.
Yes.
Space out.
Yeah.
You know, eat right. You know, monitor yourself. So it took us back to basics. And I think the reset was needed.
I think so.
Yeah.
I think the reset was definitely
The reset was needed.
And sometimes that's what happens. I remember one of my mentors said this, like God said, everybody go to your room now. Go now. Go to your room, stay there.
Yes.
Don't come out until I say what's going to happen. Like, wow.
What?
But it was good. And I think
was.
sometimes change is hard.
Yeah.
And people really resist change. They don't like change. But I love the parameters and the conversations that you've brought. And I think we're going to end it there. Thank you so much for your contribution. And we'll be back next week to have another conversation with Effie and Sheila on the healthcare and the healthcare system. And I think it's a very appropriate time to take stock of our health. We're starting a new year. God bless you. Bye-bye.